Hello, everyone, and welcome to the Meredith A. Cowden Foundation's On the Rise GVHD Ambassador Program presentation for GVHD Day. What we're going to do today is, as you can see, there's myself, Meredith Cowden, and I'm here with three other amazing people who I adore, and they're going to share their stories with you as well as talk about graft versus host disease. So this is how we wanted to, really like losing words, like kind of think about and celebrate and sort of focus on GVHD Day by sharing information and sharing stories. And so then through that we can help, hopefully educate people and help people connect and then just help you feel empowered and like you're learning information that you can take away with you and you can take it to your care team or you can take it to your doctor or your family or your friends or whomever. And so then we can really, as a community, like start to amplify our voices and start to really, move things forward in terms of what it means to have GVHD and what it means to manage it. So with me today, I have JR. Can you
How
wave,
you
JR?
doing? Wave.
Hi. Hi. And so he is going to talk about his story as we go through everything. And then we have Brittany. Hi.
Hello.
And then we also have Vadrana. And so so what we're going to do is throughout, like everybody's going to provide some information through weaving in their own story and their own experiences. Because who better to talk about graft versus host disease than the people who are living with it? And so part of the goal of this, so with the On the Rise GVHD Ambassador Program, our goal was to, just like it says, reach, inspire, support, and empower. And that's speaking to everyone in the GVHD community, not just people who are living with it, because it does affect a community of people. And so, with today, what we wanted to do is really bring together a group of people. So, what we're going to do as we go through things is we're going to, like I said, JR, Brittany, and Vadrana are going to talk about their experiences, tell a bit about their story, as well as provide like a GVHD 101 kind of thing. So what that means is, talk about what it is, talk about the organs that it primarily manifests in, how to communicate with your care team and your doctors and how to, work with them as a team, as well as discuss treatments. We're going to present some treatments and information for you, and just like what a general understanding of GVHD is. So, so now we're going to move forward. I'm going to turn it over to Vadrana. And please, Vadrana, just talk about you, your life, how fabulous everything is.
Hi everyone, my name is Vedrana. I'm from Croatia. My journey began in 2016 when I was diagnosed with acute lymphoblastic leukemia. Um, I had 6 months of chemotherapy, and then my physician team decided to have a transplant. I had my first transplant in 2017. It didn't go as we planned, so we did another one 5 months later. And everything was good after second transplant. But in first 100 days after transplant, I developed symptoms of GI tract GVHD. It was acute GVHD. We managed it by pills. I thought it was doing great after that. Everything was good. But less than a year after second transplant, I developed symptoms of skin GVHD. So my care team tested me for others GVHD, and it And it shows that I have GVHD of mouth, eyes, skin, liver, lungs, vaginal area, joints, and I think that's all. So I have the most of GVHD. I didn't know much about GVHD before transplant. Uh, the doctors gave me a piece of paper that in which was written about GVHD, but some common information that you can, after transplant, you can develop GVHD symptoms. It can be acute or chronic. I read it, but I didn't pay attention to it. I didn't ask my doctors about it. When the first transplantation was done, I didn't have any symptoms, so I thought, okay, I don't have GVHD, everything is good. But after second, when I had acute GVHD, then I started wondering if I had any other GVHD acute at that time. So I start self research. Um, I work in IT, so Google is my best friend. So I started Google. But when you Google some disease, is always the bad things that you find on Google, nothing good. So I started to talk with my doctors about it, and they told me that the acute GVHD is done, you don't have it anymore, but there is a chance that you can have a chronic GVHD. So on every visit to the doctor, every 2 weeks, they would ask me, "Have you seen anything on your skin? Have you seen uh, anything on your eyes, mouth, on other areas?" And I was like, "Why are you asking me that? Why does it matter?" And then I found some literature where I read, okay, these could be symptoms of chronic GVHD. And then in October 2018, my skin was turning, I get a little dark spots on my skin. And I was thinking, okay, this is GVHD for sure. I come to my doctor and show it to her, and she said, it's GVHD, let's do the punction and confirm it. After the results come, it was confirmed that it's GVHD. She sent me to take tests for the others, and we find out all the other GVHDs that I have. I wasn't concerned, I wasn't worried, I wasn't sad. I'm really positive person. I like to see positive in everything and in everyone. So I was like, okay, I'm here, doctors are here, they will help me. They will tell me what to do, how to manage the illness, what my family could do to help me. I have a huge family. They all support me. I have a lot of friends who support me, my coworkers. So I embrace GVHD as a part of my life. When anyone asks me, how are you? How's your health? I'm just saying, it's okay, business as usual, as we say it in IT. I'm living the best time of my life, regardless of GVHD. I'm trying to live as a, I'm not going to say normal person, we are all normal. I'm going to say as a healthy person. I'm working, I'm traveling, I'm spending time with my family. So GVHD is part of my life, but it's not in control of my life. And I'm living the best life I can live.
Yeah, I think that's amazing. I love that, Vadrana. And so next we have Brittany.
Hello, my name is Brittany. I am from Ohio. I am married. I am uh I am currently my husband and I are in the process of adopting three children. So we also have that going on and I also work full time. I was 19 when I was diagnosed with myelodysplastic syndrome, so in 2010. I at first didn't know what was going on. I was super sick. I was having a lot of stomach issues. I couldn't keep food down. I went to the first doctor, which was actually at the ER because I was in so much pain one night. They ended up running some tests and couldn't figure out exactly what was going on. All they had told me was that everything seemed to look okay, but my white blood cell count was down and I should follow up with my family doctor just to kind of recheck that in a week or so. Um, from the point that I was in the ER to about 2 or 3 weeks, I actually refused to go see my family doctor. My mom actually had to push me to go see my doctor. She's like, no, Bri, like something is wrong. Like we need to just get it checked out. So long story short there, I did end up finally going and seeing my family doctor. And we ran a whole round of tests because from the ER visit to seeing him, my blood count, my white blood cell count had actually dropped even lower. And it had gotten to a point where he was actually concerned about it. So we ran quite a few different tests. He ended up wanting to see me back a week later to redraw my blood to see where my levels were at with that. And from that point, or the third time being drawn, my white blood cell count had dropped even farther. So he ended up referring me to an oncologist who was going to do a bone marrow biopsy. And I went through my first bone marrow biopsy in August of 2010. And that biopsy had come back that I had acute myeloid leukemia, which would actually be a step above what I had had. Um, a lot of things were going through my head at that point. I didn't know where to go. I was about to begin college and I kind of felt like my life was being stopped in front of me and I had no idea where I was going from there or what to do about it. I just knew that I had this big scary word in front of me that I was just told that I had cancer and um, it was a lot of emotions, to be honest. So talking things over with my mom and just trying to figure out the best plan of action, we decided to go to the doctor that I actually continue to see now, but they're in Cleveland Clinic. And we had a second opinion done with the bone marrow biopsy. So I had my second biopsy completed 2 or 3 weeks after my first one. And that one came back that I did have myelodysplastic syndrome, so not quite AML. After finding that news out, we then discussed the plan of care that I was going to receive. I was with one doctor, and she was an amazing doctor. She really sat through with things with my mom and I, because my mom was my main caregiver. She sat through a lot of my appointments and just talked with us and guided us on what was going to happen and what would be taking place. I was admitted into the hospital in the latter half of October of 2010, and I began my first round of chemotherapy. Um, what I can tell you about that and being in the hospital for a month then, I was very sick. I don't remember a lot of it. I know I had a lot of infections going through chemo, and for me and my mom, just for a lot of people, we know that it was not a fun time, to say the least. Um, so after I went through my first round of chemo, I was actually able to be discharged to go home, which was a couple of weeks before Christmas. And from that point, it was kind of like a waiting game because I was told that I was going to need a bone marrow transplant, and um, we had to find a donor because none of my siblings were a match to me. So fast forward a week before Christmas, I had my doctor's appointment, and I specifically remember this like it was yesterday. My doctor kept asking me what I wanted for Christmas, and we'll just say that chemo made me a not so happy person because I kind of sniffed at her, and I was like, I really wish people would stop asking me that because the only thing that I want, the nobody can give me but God. And she was like, well, what is it exactly that you're wanting for Christmas? And I said, a bone marrow transplant. I really would like to find a donor and be able to know that I have a fighting chance at life. And she just got this big smile on her face and told me that she and her team and everybody else that she worked with, that a donor was found. And I started crying. I was so happy, so ecstatic, and I had so many questions. But my first question was, all right, when can I have this transplant? Um, so we ended up getting that scheduled for January of 2011. But before I could go through the transplant, I had to go through another round of chemo to wipe out my system, my immune system. And then I was able to have my transplant. So I had that transplant done on January 27th of 2011, 5 days after my 20th birthday. Fast forward a little bit. I was diagnosed with graft-versus-host-disease of the lungs um, about a year after my transplant. So I was an avid runner. I had actually broken my ankle twice, not once, but twice. The first time after breaking my right ankle, I got back into running with no problems. The second time, I ended up breaking my left ankle. And after going through therapy with my left ankle, I got back into running and I just noticed that I was not able to catch my breath as easily as I could before. And I just kind of took it as maybe this was me being just out of shape because I hadn't ran in over 8, 9 weeks. Actually longer at that point. Um, so I just kind of kept pushing through and just trying to see what I could accomplish, and it just wasn't happening. It felt like every day that I would go out running, my running was just getting worse. And then one night specifically, I was coming up the stairs from our basement and I was very winded. And I looked at my mom and I'm like, something's wrong. We need to call my doctor. And that's when we ended up calling my doctor and just kind of letting them know what was going on with my symptoms. It really just kind of felt like an elephant was just sitting on my chest because I was just having such a hard time catching my breath from climbing that flight of stairs. But we called my doctor. They admitted me for, I believe it was 3 days. They ran tests and it was confirmed that I had the start of graft-versus-host-disease of the lungs. Graft-versus-host-disease of the lungs is a chronic lung condition, and unfortunately, it will never go away. But I have learned to manage it. And like Radrana, GVHD doesn't stop you. You can still live a great full life with GVHD as long as you're not willing to give up on it. So that is me.
Yeah, thank you.
You're welcome.
And so next we have JR, last but not least by any means.
Hello, yeah, my name is JR. I currently reside in Bozeman, Montana. Actually, pardon the pun, but was a transplant from the East Coast to the West Coast, and then now here in the Northern Rockies. So my original diagnosis was acute lymphoblastic leukemia, ALL, like Verdrana, and I had my stem cell transplant in March of 2017. I was originally diagnosed in Labor Day weekend of 2016. Also took, several months, I think 8 months to find a donor. And after that, my chronic graft-versus-host-disease kind of started filtering in about a year and a half later, October roughly of 2018. So my primary symptoms started, I was away at a training seminar in the San Francisco Bay Area and started having some upper left abdominal pain. Also noticed a small bruise, maybe not small, it's probably about as big as a silver dollar, on top of my foot that looked like a possible spider bite. And when I went back home for the weekend after the training, the pain started increasing and I developed a fever. Because I had a history of diverticulitis, I thought, hey, maybe I have a small, gut infection starting. So when my wife got home from work on one day of that weekend, we decided we'd go over to the emergency room. And at that point, it was at Kaiser Hospital in Roseville, California, kind of a small suburb of the Sacramento area. They took me in, did some blood work. We're working on a few things and came back and said, we're going to need to run some more tests because your platelet count is extremely low. It was at 10 or 10,000 in that count. And so they originally thought possibly, maybe it was a viral infection that's causing this, and they did a bone marrow biopsy early that morning And when the results came back from that, it showed that I had the ALL. And on top of that, I had a Philadelphia positive chromosome, which they told me was the turbocharger for the ALL. So things were moving quickly. My oncologist said that my options were to start chemo on a 26-day routine, or if I chose to go home, I'd have about 2 days left. So I, decided I'd go ahead and give that chemo regime a try. So after 26 days of that, they were able to get me clean. There's no more leukemia in the bone marrow at that particular time, and they said that because of that Philadelphia chromosome, they were going to have to move forward with a transplant in order to, try to get a cure for this. So they started that process of searching, and like I said, it took about 8 months. And so every month I would go in and spend a week at Camp Kaiser, I called it, and go through my chemo regime. Uh, this when they finally identified it, we went to Stanford Hospital in Palo Alto, California, and that's where I was going to receive my stem cell transplant. I had fortunately had great caregiver support. My wife had two at that time. One, my son was in his freshman year of college and was actually away studying abroad in Ireland for a semester. And my daughter was in high school, a senior in high school. So I had my mother-in-law help out, and I just can't say enough about having a strong support system in place. When I started the treatment options before stem cell transplant, I didn't recall really any discussions about GVHD. After the transplant, we talked about uh, acute GVHD, and that actually started. It was mouth, throat with the thrush. I had all of these symptoms for about a month or so after transplant. I used a kind of a little steroid rinse for the mouth. And then about 18 months later, I started to notice some skin dimpling on the inside of my biceps. And it was more like a kind of an orange peel kind of look to it. And I had actually taken pictures of it and sent it to my oncologist that was actually a fellow at Stanford. And she worked at the Kaiser Hospital. She was my regular oncologist. And she didn't even recognize it at that point. And so when it went back to my Stanford team, they were like, yeah, for sure, this is GVHD, and we're going to need to start a treatment on that, a chronic GVHD. And basically that's where it started. And they started that treatment, that next week. It was that treatment was a Rituxan, which was an IV treatment. Uh, and so based on my experience and all of this is, my message is of hope. As a transplant survivor, I'm just happy to be here. If GVHD is all you have to deal with, you can make some changes and figure it out. And I think, like both Brittany and Verdrana, you make some changes and you enjoy your life. You're happy, and you just kind of figure out the best way with your clinical team how to take care of this condition.
So what is GVHD? GVHD stands for Graft-versus-host-disease, and it's a rare condition. We don't have a lot of report data of cases of GVHD all over the world. You can see on this map we have reported data from US, some parts of Europe and Japan, but we know there are some GVHD cases all around the world, but they not been reported. So we know there are much more people that have chronic GVHD.
So GVHD can happen after bone marrow transplant, like it's happened to all of us. Of course, transplants are intended to treat, many different mostly blood cancers, but there's multiple myeloma, leukemia, lymphoma. There's various non-cancer ones like sickle cell and aplastic anemia, myelodysplastic syndromes, and myeloproliferative disorders.
And so basically, when you have a transplant, the donor cells, it can see your cells, or I'm sorry, your cells can see the donor cells as like a threat. So it's usually when you see GVHD starting to attack, and it's called graft-versus-host-disease, but it attacks the person's organs or tissues and that part of their body. And that's when you can start to see the different things popping up.
So what are the main types of GVHD? As I mentioned it before, we have acute GVHD and chronic GVHD. Acute GVHD can be diagnosed in nearly after transplant. Often it gets diagnosed in 100 days after transplant, and chronic GVHD can be diagnosed years after transplant. For me, it was less than a year, but I know people who had transplant and diagnosed with GVHD like 3 or 4 years after. So acute is manageable, but and you can get rid of it. But chronic, it takes longer to take, I'm missing words, to get better, but it's manageable.
So there's many early symptoms of chronic GVHD. It's can include skin rash, sensitivity and dryness in your eyes, mouth, etc. It usually affects more than one organ. In my case, the acute was fairly short-lived, and then all of a sudden the chronic seemed to come out of nowhere 18 months later. I was always comforted by the fact that GVHD was confirming that my new immune system was doing its job, just doing it a little too well.
So if you haven't been diagnosed with GVHD, but you've noticed symptoms, it is extremely important that you talk to your team right away, especially if you notice like something is severely impacting your day-to-day life. And sorry, can we go back? I just wanted to kind of like segue into that with JR and just some of the things that his doctor had shared with him when he started to notice different symptoms and signs.
Yeah, and for me, here's some of the common ones are skin and nails. I mean, if you look at your skin, you can potentially you'll see it tightening, changes in colors, pigmentation, uh, fingernail changes. They can become have more ridges develop on top of them. They become thinner and crack easy. Joints and muscles, it becomes arthritic type symptoms, difficulty closing your hands all the way or making your wrists up and down, moving them in, they call it dorsiflexion, or not, yeah, dorsiflexion, plantar flexion, that's for feet. But anyway, to be able to move them up and down normally. In your eyes, it's irritation that doesn't go away, dry, sometimes your vision can get blurry. And then of course, there's liver, if dark color urine, your skin's turning yellow, these types of things, it is where you want to make sure you're definitely getting in touch with your clinical team and providers.
I want to pop in here. If you go back, please. When I noticed that I have GVHD of my eyes, it was like I have a sand in my eyes that I can't get rid of. And it was very difficult to manage and to see, and my eyes were really red because I was always dealing with it. It was not very good. And you mentioned the nails. They are cracking, not horizontal, but vertical. And for me, it's a lot of pain when the cracks. It goes in my skin. The nail goes into my skin. So these were my symptoms for these GVHDs.
And here's a few pictures of myself as well as Vadrana. But if you look going in order from the left to the right, you can see some of the skin dimpling, which appears to be in the fascial layer between the skin and the muscle. In that second picture, I'm actually squeezing the skin around my wrist, and usually a normal forearm, you'd be able to pinch that skin up pretty easily. Mine's very tight and sclerotic. There's another picture of the forearm, as well as a picture of have basically like one nail left that's causing me issues, and you can see that second one down from the top has got some splitting. And then there's a picture of the inside of where my bicep is, where that's going. That's where I'm at now currently. I know, Verdrana, you have your pictures there. You can talk about there.
You can see the last two pictures are of my body. JR and I have the same GVHD, but it manifests doesn't manifest like the same. I have all brown dots on my skin. I call it cheetah skin. And it's all over my body except for my face. So, and the skin is also thick. I can't pinch myself like healthy people can.
Here's a couple more pictures. So that demonstrates that is me making a fist as tight as I can squeeze it right there on the left. And so that has gradually it has gotten worse or has increased over the last few years. Currently, going through some other treatments and being referred to Fred Hutch in Seattle to have some more evaluation on that, and hopefully, maybe get a little bit more improvement. On the right is a picture of me doing the prayer hands, or lotus, whatever you would like to call it. It's one of the things that they'll look and ask for you to do in clinic observations to see how far down you can get your wrist to bend. And for me, that's the current maximum. So those are some of the things. Like if you wake up in the morning and you realize your hands, it's hard to make a fist, or it's getting harder to move your hand up and down, just a little difference in that day, that's something that you would want to alert your clinic team to right away.
Here are some other symptoms. We mentioned it earlier. So for the mouth, if you have a dry mouth, if you have trouble swallowing, if you don't have enough saliva, if I said it right, it could be a symptom of GVHD. There's the lungs. For me, when I noticed that I have a GVHD of lungs, was my breathing. I couldn't catch the breath. And a little bit after that, I started to cough often. So my lungs are now working on 40%, and I have trouble breathing still, and I cough every day. So if you have some symptoms of this, you have to tell your doctor. For GI tract, there are diarrhea or vomiting or nausea, and there is a nervous system. If you're having some pain in your hands or feet or numbness, you should talk to your doctor and see if it's GVHD.
So usually GVHD is a 3 to 5 year treatment issue when you're diagnosed with it. I got really lucky, and mine's been going on for 7.5 years now. So I'm pretty familiar with the signs and symptoms. However, being a forever optimist, I can still ignore these, and I think I'm doing well. And that's where, having your caregiver keeping you honest about what you're experiencing is a huge benefit. I know that when I go into my physician's appointments, I like to have my wife come with me because he'll ask how I'm doing, and I'll say I'm doing great, and she'll be in the background shaking her head. No, this is what is actually going on, and kind of helps to keep you honest a little bit. What Virginia said as well with the, experiencing some neuropathy in my feet, my physicians were like, it could be from the chemo or it could be from the graft versus host disease. So those are things to also kind of keep in mind if you're dealing with either foot numbness or pain. Usually it starts in the feet by the toes and the ball of the feet.
Yeah, so what people can do if they have GVHD, so they can, just like their daily lives, they can be affected by GVHD. I know personally for me, climbing stairs is very hard for me. I'm also with Verdrana with my lungs. I cough every day and it's very hard for me to catch my breath. So oftentimes if I'm in a hurry somewhere, I have to slow down or just make sure that I'm taking extra time throughout my day just to kind of do what I need to do. But your quality of life, it can be impacted by the different types of GVHD that you experience. And in some severe cases, it can even be life-threatening.
So let's move to the next slide, please. Thank you.
Okay, this all that we said may sound very scary. It's a lot of information. Don't Google it because you will get a lot of more scary information. But there is a light in the end of the tunnel. It's called hope. So you have to have hope and everything will be okay. You can live a normal life.
Yeah, I look at it like this. I'm almost 8 years post-transplant, and I think about what it's been learned in that period of time alone. We have more treatment options than ever before for chronic graft versus host, and we'll likely have even more before you know it. I actually have glaucoma, and when I see my eye doc, who fortunately sees, really has been invested in my a successful outcome with the GVHD, and she always tells me, we got these drops, they're working for you now, and in a few years we're going to have more. So there's always seems to be this process of hope.
I would definitely agree with that. Like, no matter what, going back to what we had originally said with what our message is, like, just never giving up on your life and never stop living just because you have GVHD. I know there are a lot of barriers that my lung doctor, even my oncologist, thought that I might not be able to overcome, but I've been able to overcome those, and I am very grateful and very thankful for that. Um, and like one of the things that I used to love doing, which was running, I did have to give that up because I just couldn't figure that out with my lungs. But I was able to take up road cycling, and that is still my way of just getting out there and enjoying nature and enjoying this earth, this beautiful earth that we have to live on.
So, first I apologize for the crashing noise. That was a cat. Uh, Now it's done. So, okay, so as far as, so we've seen some symptoms, we've seen the ways that graft versus host disease manifests. And so now I'm gonna talk about the treatments that are available. And so when you start out with treating graft versus host disease, whether it's acute or chronic, everybody starts out with immunosuppression drugs or medications because it makes sense, right? So like Brittany was saying when she was talking about how the immune system works with GVHD, so if the immune system is the thing that's attacking the body, then if you suppress the immune system, then it's not going to be as strong and it's not going to be able to impact your body as much as it would if it was like a fully functional, like superhero kind of immune system. So immunosuppressive drugs are the way to go. And the one that is the front line of treatment that has been for a very long time is corticosteroids. And steroids are, I kind of think I've recently kind of created an analogy with Dr. Jekyll and Mr. Hyde, because on the one hand, like they're great, right? There's a reason that the first drug of choice for so many years is because they work quickly, they work efficiently, they get things taken care of. Then the problem that happens, that can happen, is that they also have pretty significant side effects. And, if taken for a very long time, then then they have other ways that they're detrimental to your body. So the idea is really to try to not take them for years and years and years on end. And hopefully, like you or whoever it is that you're working with who has GVHD is on the shorter end of, the stuff. And if not, that's okay. I'll talk more about options at the next slide. And so corticosteroids are typically most often taken in two different kinds of ways. If they're taken systemically, then it's through an oral pill or an IV. If you have high doses, then it's through an IV. If it's something that you take like as a pill just every day, then that's generally pretty easy to do. And that is because it's entering your bloodstream and because of how it's being digested and metabolized in your body, it goes throughout your entire body. So it's systemic. There's also topical steroids. So kind of like we were talking about earlier around, like JR was talking about a mouth rinse that he had for his oral GVHD. So there are different kinds of topical treatments that people can use. So mouth rinses, eye drops, like we talked about that earlier as well. And then also there are skin creams that have steroids in them, but they're not affecting the rest of your body. If you have something like lung graft versus host disease, there isn't well, actually, there are inhalers that are primarily steroids. That was a bad example. Let's look at GI. So if you have GI, GVHD, then there isn't anything that can just specifically target that. And so that would be something where you would take more of the steroid pill. That's a systemic way of treating. And there are, like I said, there are other kinds of medications and treatments that you can use. And then there is such a thing, if you could go to the next slide, please. There is such a thing as something called steroid refractory GVHD. And so there are situations and there are times when steroids just don't do the job. Like it's not it. The immune system is like, move out of my way. I'm moving ahead. We're done with you. And so then when that happens, we're very lucky. We've been very lucky within the last 5-ish years, yeah, I want to say where we've had 4 drugs that have been approved by the FDA specifically for the treatment of graft-versus-host-disease. And so those drugs are often used if and when steroids stop working, and also they're kind of used to help taper somebody off of steroids. And the drugs, we have them listed here. So the axatilimab is the most recently approved drug that's out there, and it has really, really promising research, clinical study trial results. So that's something that is very exciting. And then we have belumosudil, ibrutinib, and ruxolitinib. Ruxolitinib was the first one, and so each of these target different cells and different areas of your body where the GVHD is really, really focused. So like for instance, ruxolitinib is the other name for it is, I say Jakafi, some people say Jakafi. I never know. So I'm just going to go with Jakafi. So it's called Jakafi and it's a JAK inhibitor. And so that then it's targeting the JAK inhibitors. That's how that drug works. And the other drugs, some target your T cells or your B cells. And so it's a good idea to talk to your doctor about what's happening for you, because then your provider and your care team can look at what's happening and then make a decision based off of what your symptoms are, how the GVHD is manifesting, of what would be the best drug for you in your situation. So it can be more tailored rather than like an across the board sort of thing, like what happens with steroids. And also, another thing that I think is incredibly valuable is the discussion and talking about and learning about what kinds of clinical trials and clinical research studies there are out there. And I think, JR, you're going to talk about that, right?
Yep. So, of course, drugs are they come to fruition through clinical studies, or research studies. There's different clinical trials for all different types of conditions. And for me, during my transplant, I actually was able to sign up for a clinical trial. It was exploring three different transplant processes or arms that they were considering at the time, to reduce the chances of acquiring GVHD and chronic CGVHD. Uh, and so for my transplant, I was placed on the standard of care arm. So I didn't get to, I mean, I participated, but I was the kind of a control arm. The other two arms were exploring different techniques, using different types of how they would actually manage the bone marrow donors' cells to kind of clean them up before they would have them ready for transplant. So that was the study that I was in. It for me at the time, it just involved giving more blood every time I go to clinic. So instead of 5 or 6 vials, it was 17 vials, which ultimately I ended up with a high high ferritin levels. I think they call it hematochromatosis. And so I ended up having to do phlebotomy. For me, I had to do, oh geez, probably for about 4 years, 4.5 years. I had to take, I think it was like 42 blood transfusions, and my doc told me for every one you take, you got to give one back to get rid of the iron stores in your body. And so that was, a side note, giving them those 17 vials of blood helped with the phlebotomy. So and then if you can advance the slide, please. You and your doctor, you may want to enroll in a study. And up on the screen here are some QR codes that you can scan and come up with some, places to do a little research to see what type of uh, studies might be available for you to participate in. You can take a picture of this slide, and then you can check these out later.
If you can go back, please, one slide. Here in Croatia, we didn't have any clinical studies of drugs, but when I was diagnosed with GVHD, we have a study that was managing the people who were diagnosed with GVHD. We had a team, and they were every 6 months they were taking our blood tests to see how our GVHD is improving or not improving, how are we doing. And it was going on for 2 years, and they found out some new things that they didn't know before. Okay, so working with your healthcare team is the key to managing GVHD. That's my line, because I really, really love my care team. I have a great care team here in Croatia. I have a good relationship with them. I think they are the best. I love them so much. Why is that? Because every time I go to any member of my care team, I like to ask so many questions. Why is this? Why is that? Or why are we doing this? Why are we not trying that? Can we try this? Can we try? I think you have to have a good communication with your care team to learn about your condition, to know how to handle your condition, and to have your mental health in your hands. Don't be ashamed to ask for help if you have some mental issues. I know GVHD isn't a piece of cake. It's hard. You have to manage it. So asking for help is not uh, something you have to be ashamed of. Talk about your feelings with your doctors, with your family, with your caregivers, with your friends. You have to talk to someone. If you're having a bad day, we all having a bad day. Whether we are healthy or not healthy, we all have a bad day. Do what you need to do on your bad day. For me, is I like to stay in bed, and my husband knows it. I like to stay in bed whole day, and the other day I'm so good. I had to reset my mind, and I'm moving forward. But that day I have to stay in bed, and I think other people have different types of dealing with bad days. But in healthy life, you also have good days and bad days, like in GVHD, you have ups and downs. And Meredith knows, I say it already, you have to have ups and downs. You don't want to be in a straight line. You don't want to see on a monitor a straight line. You want to see it up and down so you know that you're living. So bad days can happen, but talk to someone. I don't know, go to the movie, stay in bed, do something to make it better.
With your care team, you may have different types of doctors involved in that. So for example, myself personally, I do have two different doctors that I see. I see my oncologist and I also see my lung doctor. For me, I see them every 6 months because my lung doctor likes to monitor my progress of my lungs. And then it just kind of coincides with seeing my oncologist as well. And I also, kind of going back to what Rodrana said, I think it makes me feel better because I don't have to see my oncologist every 6 months, but for a mental check-in for me, it does make me feel better seeing him and just kind of seeing where my numbers are when they run the tests with like my blood work and everything. So yeah, it looks different for everybody, and what it might look like for you might be different from the four of us. But this will be based on your specific symptoms generally, and this is called multidisciplinary care team because they practice different specialties. Next slide, please. And then with this, it also, again, it just kind of depends on your needs. Everybody's needs are going to be different, but they may include a hematologist, an oncologist, and your primary care doctor. And you might also see other specialists such as an ophthalmologist, dermatologist, pulmonologist, gastroenterologist, and gynecology or urology.
Yeah, for sure. This is really important because we all are going to have a different makeup of our clinical team and our related providers. Myself, for example, I spent a long part of my career working for Shriners Hospitals for Children. It was in a multidisciplinary setting. We took care of orthopedics, burns, and spinal cord injuries. And I saw from that system how well the coordination between those team members really helped the patient outcomes. So in situations like this, I mean, who's going to manage my care? What I like to do is I try to have my PCP or my general practitioner. I dump everything in their, I guess, inbox through electronic messaging, email, however you have to do it. But I always keep that person informed with what's going on with my care. Fortunately for me, several of my docs are in the same system, so they can see those notes. But for others who are outside of that system, for example, like I see a dermatologist at least annually to check for any forms of skin cancer because I was on a drug called tacrolimus, which is something that you have to look forward to. So I'll take those notes and I'll copy them. I'll send them to that team. My ophthalmologist, same thing, except she's been able to keep that doc informed through her electronic messaging system. Again, this is an area where your caregiver attending with you is really important because they can help and be the note taker. There's so much information that's being dumped on you in these different clinical situations. It's very helpful to have a second ear. So when you think about all of the different things for myself, it was I got my regular care provider. I have my oncologist. I was doing PT and OT. I just recently got a knee replacement, so I had orthopedics involved, ophthalmology because I have dry eyes. And what was fortunate by talking about all these things with my oncologist, then he's like, well, hey, let's test you swallow test and different types of things that come up that I didn't even think about, and they were able to offer those. And so you need to take charge of these appointments and be proactive. I think what I like to use the electronic messaging thing as things come to you, write them down and then formulate it into either a bullet point list or something that maybe you can send that list to your doc, maybe a week before your visit, so that when you get there, you guys are all talking about the same thing when you're there. So just writing things down is simple because it helps get it out of your brain by putting it on that piece of paper and helps you to remember it.
Can I pop in really quick?
Sure.
GR
Oh
and
yeah.
Brittany, I think you are very happy and lucky because I have to go every month to some doctor. So you're happy, lucky.
It's been that way for me recently, just because I had the knee replacement and I was trying to coordinate everything. Prior to all of this, I was on what they would call a surveillance kind of schedule. So every 6 months I was getting my blood tests and it was a little bit easier. Now I'm in a little bit more of a managing some more of this chronic graft versus host. So I'm in there a lot more often. The other thing is with that orthopedic surgery, I asked him the day after surgery, I'm like, hey, when you were in there, what did the tissue look like? And he just looked at me, he said, look kind of woody to me. And I'm like, oh, okay. Then so that kind of confirms that fibrotic type of tissue. I mean, he's not a transplant doc and not really, I mean, he's familiar with the term of graft versus host disease, but by no means an expert in it. But it was interesting to get his take on it. Orthopedic surgeons are a little bit more like, give me the hand tools and the drills and all that kind of stuff, and are going to talk to you a little differently than a cell biologist. So,
Yeah, I also actually recently just saw an orthopedic as well because I started having issues with my knees. And after a scary visit to a doctor, I probably shouldn't have gone to. I should have just called my own doctors. The orthopedic confirmed that I have the start of avascular necrosis in my knees.
uh,
So I will most likely need a knee replacement at some point earlier in life than your
mine went
normal
very
age.
well.
I'm glad to hear that.
Yeah, it took 15 years off me, I swear. So,
I went to the neurology last year because I had spasms in my jaw and I couldn't open my mouth. Nobody knows why. We haven't found it was from GVHD or something else, but I'm getting Botox for that and I don't have wrinkles here, so it's great. Okay, we can move on. Challenges with GVHD. Yeah, life with GVHD has challenges. Um, I have a daughter, she's now 9. She goes to school. Every time she's sick, I'm sick. Every time she has a flu, I have a flu. She gets better in few days, I get better in 3 weeks. So I work full time, but I have to go on my sick days when I'm sick. I have to balance my work time with my doctor's appointments. Like I said, I have a really great coworkers and boss and CEO in my company, so they are okay with me going to my appointments in working hours. Uh, GVHD can um, stress you out, but you can manage it. You can stay. It's you can. It's really good if you stay active. Don't sit around at home and think all about the GVHD. Go out, get some hobby, read a book, try to learn new language or something just to stay active with your brain and your body. When I was diagnosed with ALL and later GVHD. I wasn't concerned, I wasn't worried about me. I was concerned about my daughter because she was 10 months old when I was diagnosed with ALL, and a year and a half when I was diagnosed with GVHD. But I have full support of my family, and they take care of her when I was in hospital and when my husband was at work. My biggest scare was after first transplant. I was 50 days in hospital, and I was like, when I come home, would she recognize me? Because I didn't have hair. I was on prednisone. I was like so puffed up. But then I got home and she was all on me and giving me kisses and hugs. And that's the great part of all this that we are going through, because you have someone that is waiting for you at home and someone to fight for. So I'm very thankful for the support that I received. And that's all. That's all I want to say.
So with GVHD, it is very important that you take care of not just like your physical well-being, but your nutrition goes hand in hand with that, and just making sure that you're eating the right foods. So as you work with your team, your bone marrow stem cell transplant team, whomever it all includes, just let them know of the challenges that you might be facing when it comes to any like food aversions or digestion problems that you might have or face. In particular, if like you don't have an appetite and you're not able to eat well, or if you start to get sores in your mouth, which I actually did go through during chemo. I ended up developing really bad sores in my mouth and I wasn't able to eat solid food. Awful. But we made it through it. So just make sure you're mentioning things like that. These challenges with your nutrition, it makes day-to-day life very challenging, especially if you can't eat, because it is an important, vital part of your day-to-day life. You need to be able to eat. So very important, just talk with your doctors if you notice anything when it comes to your nutrition. Next slide, please. And then just kind of continuing on with this. So with the mouth and throat sores, drinking through a straw to help with that, to help get food down, can certainly help kind of lessen the pain. I know for me, I had to eat baby food. It was the only thing I was able to get down that didn't bother my mouth. So you can try soft food, such as mashed potatoes, puddings, yogurts, ice creams, anything like that. Baby food's another great option. Soothing options. Yep, I'm sorry, I already mentioned that. And then some of the other symptoms that you could experience is diarrhea. So just kind of make sure you're drinking extra fluids to prevent any diarrhea that you might, or dehydration that you might be having. And avoid eating any bran or whole grain cereals, raw vegetables, beans, broccolis, stuff like that. And avoid drinking caffeine, any carbonated drinks, such and such on with that. Next slide, please. If you do experiencing any nausea or vomiting, please just make sure you're also mentioning that as well. You can try to eat more frequent meals throughout the day that are smaller. For me, I know crackers usually tend to help ease my stomach a little bit when I'm feeling like I can't get something down. You could try low-fat foods such as cooked vegetables, canned fruits, baked skinless chicken, or a dessert such as sherbet, popsicles, vanilla wafers, angel food cake. And then a lack of appetite and weight loss, it can definitely occur when you're not getting the proper nutrition. So just make sure that if you are able to get food in, that it is high in nutrients and high in calories. You can try cheeses, whole milk, eggs, avocados, Greek yogurt, anything along those lines. And then just kind of considering with your care team as well, any supplements that you might be able to take too.
Well, now that I'm hungry after that, and then thinking about exercise, which you may have been an avid exerciser prior to this, but for sure after, the most important thing is you want to keep yourself moving. You want to keep your arms, legs, joints, everything moving as much as you can. For me, I have a fair amount of foot pain, so walking longer distance is difficult for me, kind of like Brittany. with the running. I participate personally in an aquatic aerobics program that I have available here in Bozeman, and it's a nice therapeutic pool. It's like 89, 90 degrees, and I do that 3 times a week, and that just helps me with all that used water weights and noodles and things that I've only saw my kids used to beat themselves over the head with in the pool. And now I'm actually using them for exercise, so it's crazy. I also have an e-bike. I used to be an avid motorcyclist. I kind of have gone away from that just because it's I don't trust my ability to hold it up anymore. So I do have an e-bike. So I get an exercise on that, and you have that backup of the electric motor to kind of help you with some of the more if you have difficult inclines or different things like that. PT and OT is a great resource. They can evaluate everything, offer you exercise type programs that you can do at home with, certain types of things like TheraBands, for example, and different types of weights. Uh, and as well, for me, massage therapy has been a welcome relief for my skin and my joints. I have a massage therapist that utilizes a hot oil with scraping tools like they use in PT and OT environments. And that kind of helps to separate or feels like separating the skin a little bit and gives me a little bit of freedom of motion. So I do that a couple times a month. And it's been very helpful. So again, the biggest thing is just keep moving, get out and do something and enjoy the outdoors for sure.
Yeah, and just to add onto that, if you don't mind, if we can go back one slide, just to stay physically active, it is very important. This is what I actually do for a living. I teach people how to stay active and how to work muscle groups that they may not particularly work every single day. This is just, it's such a big part of my life, and it's how I can also just hold myself accountable to making sure that I am too staying active and just giving myself a fair chance at creating an environment for myself or a life for myself to where I am not my body's not decreasing with all the things that I've been through. If that makes sense.
Yeah, to piggyback on that, my primary care provider suggested that I go ahead and do what's called a DEXA scan or a bone density scan.
Yeah.
And my orthopedic surgeon, after evaluating the joint placement and how the bone material was, definitely followed up on that. And he said, "Yeah, go ahead and get it done now. And then after your 12 weeks post-op on the knee, I want you to start doing some weight bearing exercises." So, I did the DEXA scan. I do have some osteopenia in the lower extremities. My spine was good, but that was probably a result of steroid treatment throughout chemo or the chemo itself. So I started another physical therapy program, after I've just rehabbed from the knee, and that's been very helpful. She's my current physical therapist is really working with me to try and load those long bones to help. I've also increased calcium intake, but of course you want to, verify those things, with your provider and make sure that's the right path for you if you happen to have that.
Absolutely.
Yeah, for me, I have a milestone. If you can go back, please. For me, I have a milestone to do every day, 10,000 or to 15,000 steps. I like to walk. We have a beautiful nature here around my building, and me and my family go hiking. When the weather is okay, we go every weekend. But now in the winter, it's one weekend in a month. So I stay active, and I recorded a video of exercise you can do at home for people with GVHD. We put it on YouTube. My friend is a fitness trainer, so he helped me to do this exercise and explain how to do them right, so people in Croatia can help themselves at home. We can go to the next slide. GVHD, as it says, is a full-time job. It's always there. You can get rid of it. It's like you have another person attached to you. So you have general health issues. Like I said, when my daughter is ill, I am ill, and I have a chronic bronchitis. I don't know how do you say it. It's difficult to be social because your immune system is not good, so you're afraid of viruses and bacteria and everything else. We have a pandemic not long ago, so you have a problems with sleeping, depression and anxiety can occur. But if you feel overwhelmed, it's normal. It's okay to ask for help. As I said, don't be ashamed to ask for help, and seek support from therapists.
Yeah, I know for me, being positive goes a long, long way. Uh, I try to embrace my new life. I do the best I can to adapt to the ever-changing landscape of GVHD, and you'll definitely persevere. I mean, when you have a day that you're just tired, your feet hurt, take a nap. Just give yourself some liberties, if you're in that a space to do that. Other things that I try to do is, for me, I've kind of retired. So I try to get out of the house, try to do the whatever grocery shopping, et cetera. If my wife's at home either on a weekend or in an evening, maybe go for a drive and enjoy the area that you're in. If there's a place you like to go for a meal or maybe a new place to try or happy hour or something like that, just have something to do to break up so you're not thinking about it all the time.
Yeah, no, absolutely. Like unfortunately, I experience a lot of anxiety. I honestly, I have, well, I experienced it long before I ended up having to go through a transplant or anything, but I think that just kind of amplified it all. And for me, I love to talk. I love to get my feelings out. So anytime I have my husband home or my mom or one of my sisters, I'm always like just jabbering and talking their ears off. It's not always about negative things. It's usually about a lot of positive things, but just I know that I can confide in them if I need to. So just make sure that you have your circle of people who you can kind of talk to as well if you need them. And then, so here we do have some helpful resources that you're able to take a photo of. All you have to do is just take your phone and scan those QR codes to each of those affiliate links, and it will give you a lot of great information on different resources that you can utilize. Just kind of going through or experiencing GVHD, it can be challenging living with it every day. But just knowing that you're not alone is the biggest thing that we want you to know. We are here with you and we are rooting you on every step of the way. So anything that we can help to give you, just make sure that you're taking those tools and utilizing them because it really does help.
And so we want to talk about GVHD Day. I just want to like throw a little plug in there because it's today, right? And also it's always going to be on February 17th. And much like other days that are there to raise awareness and education and support around specific disease states, we also thought that GVHD is very much deserving of that. And it is a rare disease. And so it's not really that well known. And so what we're asking you to do, please, if you would be so kind, is to, whoever you are, whatever role you play within the community of GVHD, share your voice, tell your story. What is it, what are the things that today so far we've been so lucky I feel lucky to have, to learn these wonderful things and to learn about the experiences of Adrana and JR and Brittany. And I think that, if you have something like that can share, please do. So as much or as little as you want to, right? And so like if you want to share pictures or if you want to share a video or create a reel, whatever. And so like whatever it is, and if you just want to say, hey, it's GVHD day, that's good too. And last one, I think that it would be really cool. This is just because like I want this to go all over the world. is that I think, if you can, there's going to be a link for this video. And so you can share the link on your social media and then it can spread out. And the more people who can learn about graft versus host disease, the more people are going to be empowered and connected and educated. And that's really what we're trying to do, right? We're trying to amplify those voices, like I said. So please remember, we have hashtags down at the bottom that you can use, that we encourage you to use, so we can really create that really strong, cohesive connection.
So takeaway is GVHD is manageable. You can live with it and enjoy a happy life.
If you think that you see signs of GVHD, immediately tell your doctors and don't be afraid to speak up about any of the signs or symptoms that you're experiencing with GVHD to your caregivers, doctors, bone marrow team, or transplant team, stem cell transplant team. I'm sorry.
Ask your doctor as many questions as possible. Ask them anything you ever wanted to ask them, anything that pops up on your mind. Reach out to your bone marrow stem cell transplant team and make sure you get the care and support you need.
And last but not least is you can live with GVHD. I like to say you can live and thrive with GVHD.
What do we hope you'll remember? We'll hope that you'll remember that graft-versus-host-disease, GVHD, is an inflammatory condition that can happen after bone marrow stem cell transplant from a donor. It affects many organs and or tissues.
Symptoms can also include skin rashes, issues with your mouth, and more. And there are treatment options, so please work with your healthcare team to find what treatment works best for you, even if it takes a few tries.
Yeah, and please partner with your healthcare team, friends, family, loved ones, neighbors, even other patients. Let them help you when you need it. And challenges may happen, and it's okay to feel overwhelmed at times. All of us on this call are overwhelmed at times. Find the support that you need that works best for you.
So remember that you are definitely not alone. And so please use the resources that we've shared, so that you can learn more. The On the Rise program is part of the GVHD Alliance, and so that's a wonderful resource that links to all the resources that we know. And lastly, but far from least, maybe most important is, just as the message has been throughout this really great time that we've had, hearing about GVHD and hearing about these stories is, the message that's clear to me is that there's hope, right? And just as JR said, like, you can live with GVHD and you can thrive with it. And it's really a matter of, you know, looking at your situation and figuring out whatever it is that you need, and then gathering the team of people, whoever that is, family, friends, healthcare, whomever, to really help you address those needs and then like find the things that you love. And there is hope that it's not going to uh, dominate your life. I agree. I think Brittany, you said this, that it's sort of like another person. Like it's sort of like we're married, but it's not like it's kind of like a weird marriage. Um, and that like, it's something that we're living with. And also that doesn't mean that it has to define you. It doesn't identify you. It's not who you are. You are somebody who has graft versus host disease. And it doesn't take away the rest of your life. So with that, I think I would love to say thank you to JR, Brittany, and Vidrana. Thank you so much for doing this. I really appreciate everything that you've done and said. And Vidrana, I wrote down that you have an exercise video.
Yeah.
because I'll just do it. You know, like I think
Yeah.
it'd be really cool. Yeah. And I feel like you should do one too, Brittany. Like just
Yeah.
let's make them, you know? And then
Absolutely.
yeah. So again, I want to say thank you to everybody who's watching this, and thank you, the three of you. I really, really, really appreciate you
Thank
so
you,
much.
Meredith,
Thank you,
for
Meredith.
hosting this. Yes.
Yeah.
Yes.
Yeah.
Thank you so much for letting us be a part of this and hosting it and putting it all on.
Absolutely.
Thank you. Thank you for letting me to know new people around the world.
Right? Yeah.
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 We're all in it together.
Yes,
GVHD
we are.
connects people. It's not Nokia.
Yeah.
Right? Yes. Thank you.